Right. So what is that we have discussed about the introduction about the US healthcare system, wherein this is all about three different things. As I think yesterday we have discussed even about this, like when we talk about US medical system, which is all managed by CMS, which is Center for Medicare and as well as Medicaid Services. So this Center for Medicaid Services, Medicare and Medicaid Services will be looking after the activities which is under the Department of HHS, Health and Human Services. And whatever the activities and the services will be provided, everything has been protected under the HIPAA law, which has been introduced to protect the health information of the individuals while they are processing the claims as well as the adjudication. Now, in reference to the business analyst, reference to the healthcare, as I mentioned you. So, business analyst in healthcare, which majorly focuses especially onto understanding about the systems as well as the kind of medical terminologies. At the same time, whatever the HIPAA rules and regulations people will be following, so those HIPAA rules and regulations has to identify the BA. At the same time, as I mentioned you, what are the different systems organization uses, like something like claim processing, adjudication, and all that. So if there is any kind of changes to be made into the existing ones, that can be done even. So this is what in brief about uh, healthcare business analysis is all about. And today we are discussing about two different insurances. What is that we have? One is HMO, we call it as, and the second one will be called as PPO. HMO stands for Health Maintenance Organization, which is a basic plan, will be provided majorly has a provision to provide the services and all everything by the physicians itself. Whereas when it comes to PPO, it's a preferred provider organization. This is a plan which majorly focuses on the high level, high premium, where we have a provision to meet even the specialized doctors based upon the network where we belongs to, either it may be East or West network, all that stuff. So these are the two different insurance plans. Like one is, as I mentioned, like HMO, and the second was PPO, Preferred Provider Organization. People have a choice to select which insurance plan they want to take. It's absolutely of their choice, really. Whether are they going for HMO or PPO is their choice. So somebody will have multi insurances even, right? So they'll be handling two insurance policies sometimes, so that is also there. Now, when it comes to, there are few other terminologies which we need to understand and to know. So there are few things. One is about deductibles. Second, we need to know about the co-payment. Third, COB followed by EOB. So deductibles is nothing but it is an amount which is covered services which are responsible before the insurance plan start covering for any individual. So it's a fixed amount, I can say. It's a fixed amount of money sometimes where some amount of money has to be paid before any insurance plans begin for a coverage. It's all relating to the deductibles part. But whereas when it comes to the co-payment or a co-pay, it's a fixed dollar amount that we need to pay at every time, whatever right. So co-payment, it's a fixed amount of money which is paid before any kind of services which is being utilized by an individual when they are working on that. So this is all about the co-payment part. When it comes to COB, it's a coordination of benefits. Majorly, this is the one which majorly used when an individual have two insurance policies. Because sometimes people have a regular insurance followed by this, they'll be having some private insurance plans even. So they'll has to taken care of both the things. So the regular plan followed by um, even private insurance plan will also be taken. So whenever they have taken the two insurance policies, when it comes to the adjudication of the claims, the whole process, whatever the process of payment of the exact amount which is required. So it provides us the guidelines relating to that stuff, because majorly sometimes some people will have even private insurances apart from the regular insurance, what is that they were handling. So this is all about coordination of benefits, majorly focuses on individuals, whoever is having dual insurance policies, including private, followed by the regular insurance what managed by the government. So that is an optional thing, which is a choice, which is not something mandatory for all the people. So that varies from person to person, it will get varied, right? So this is all about the coordination of benefits. So when you talk about deductible, as I told you, it's a amount of money which is covered under the one which we are going to start the insurance plans covers. When it comes to co-payment, it's a fixed amount of money that we pay for every services. Whereas COB explains us about when we have multiple insurance policies, then coordination of benefits is being used for that. At the same time, when it comes to EOB, it's an explanation of benefits where an insurance company has a responsibility to explain about the kind of benefits which are available on the insurance plan. At the same time, the kind of process in reference to the claims to the policy holders to explain that generally EOB is being used for. So it's a standard responsibility when an insurance company is insuring someone for an insurance. As yesterday I have mentioned you, insurance is not for sale, right? So insurance, it's will be done upon the request of an individual or a company. Insurance company has to insure them against to the plan what is that they have chosen, right? It's sometimes it will be even assessed and it will be provided even to the organizations. So, but whatever the plan it could be, whatever the benefits which are available here, so those benefits has to be explained. But here there are two different things. One, a person is taking individual insurances comes under one category. But again, there is some group insurances. Like, for example, if a person working for an organization where that organization provide this health insurance for their employees, But whatever the packages followed by the services comes under the packages may not be equivalent to the one which they are offering outside. Because normally what insurance companies do, as you know, they'll be tied up with different organizations, maybe IT companies, all that. And these organizations like insurance companies will tie up with IT companies, all as an example I'm taking, right? So IT companies, where IT companies will provide services like health insurance services and all everything to their clients or to their employees. But the insurance plans as well as the cost of insurance services, like means for each and every service, what is the cost are they going to charge, is not same as like as the commercial insurance which available outside. Usually it is, there is a difference, because what insurance companies do, they'll come up with multiple plans, combination of plans and all, everything will be provided exclusive for that organization. It's not like the same one as they do outside. So there are exclusive plans will be designed only for that organization by an insurance companies. At the same time, utilization of those services followed by applicability, eligibility will also be based upon the band which that person belongs to. For example, a work company person is working in an organization, there are bands. Means hierarchical process. I can say in simple more terms, I can say like hierarchical process of the designations. So based on the designation, what services and how much money are they eligible for reimbursements, and all these things again will be varied even though the plans remains constant and same for that particular organization I'm talking about, because organization may have more than 1,000, 2,000, 3,000, 5,000 employees, right? So insurance companies has an advantage. At the same time, they can design the different plans for that organization. Usually they have a benefit, because whereas for individuals it's not, but whereas for organizations they have a benefit. So when they have a benefit, so they designs the plans, and those plans will be given to the people, given to the organizations. At the same time, in reference to the services utilization itself is concerned, there is a difference. As I mentioned you, when in terms of the utilization of the services, there are differences. There is a difference where they have to see and ensure that whatever the services comes under this, followed by the kind of claims, what is that they are supposed to do, those things will be based upon the designation, what is that they carry. This is also there. So here is a challenge for an insurance organizations to mention about the benefits, because it's a customized plans which normally sometimes organization has to, insurance companies has to design, where when it comes to the services and as well as the benefits, this customization has to be made by an insurance organizations accordingly, because as they are dealing with the huge amount of people, especially for the organization, right? So this is all about explanation of benefits is all about. So, but whereas when it comes to COB and EOB, most of the people will have a confusion here. COB is coordination of benefits, majorly used when a person is having dual insurances. Whereas EOB stands for explanation of benefits, which an insurance company will be explaining about the services which are falls under that particular insurance plan. At the same time, this is being used when they are applying for claims or something of that sort, right? So this is all about explanation of benefits is all about. So these are the basic things which being a uh, business analyst, we must be knowing, right? So these are the terminologies, right? So what are the services? All these things must be known to us well in advance. Now, when it comes to the government insurances, usually this, as I mentioned you, so this is all about an explanation about the Medicare and Medicaid I'm giving you. So when it comes to the Medicare as well as the Medicare, this is all depending on two different things. One is the federal government under, and second is sponsored by, provided by the state governments. So especially Medicare is a plan which is provided by the federal government to the citizens. So where people have to pay 1.5% on their salary till the age of 65. So they have to contribute. So this contribution of amount will be maintained by FICA. Please remember these terminologies because these terminologies might be useful to you whenever you are interacting with someone or when you are applying for something. So that these terminologies are important. This is where majorly when we are working on domains and all everything, this is important especially for BA because terminology is varying from one to another. It will not be the same for everyone. So terminologies will vary. And that too in healthcare, there are a lot of terminologies. Like it's not like the general one you see in regular one. So you'll be having terminologies there. So in this terminologies, like FICA is the one account. It's comes under the federal insurance contribution tax, where whatever the taxing amount as 1.5%, whatever I said, will be maintained under FICA. And once the stipulated age was crossed, the services will be taken care of by the federal government itself. At the same time, so this is all happened and managed by a ministry called HHS. So, of course, this is all comes under HHS services, Health and Human Services. It's a ministry who takes care of all the health related these things, all that. At the same time, if you talk about Medicaid, so Medicaid is a plan which is powered by the state government, especially for low income group people, for disabled people, disabled children, all that. But there are some changes have been made, or usually it happens on regular intervals, especially in terms of the services, where earlier there are some amendments happened. Like for example, any seasonal diseases won't be covered. Usually that's how usually it was. But later on, even that also was introduced. Even seasonal diseases will also be covered under a plan. Earlier, it was not that. After that, it was. At the same time, if any children below than the age of 14 has applied for an insurance, insurance companies doesn't have a right to reject the insurance request for whatsoever reason it could be, because of being diagnosed by something or whatever it was. Just because of those clauses, insurance request should not be rejected by an insurance organizations. So these are the amendments which normally happens on regular intervals. This is again depends on the situation to situation, because as I told you earlier, like now because COVID situation which was not expected. Lot of expenses for the treatment, especially for the people, happen across the world. So governments have done their best to do the amendments, and they will provide instructions to the insurance organizations even, because insurance companies cannot work or cannot do their business on their own usually, right? So because there will be a regulatory board, there will be a regulatory authority, we call it as. So regulatory authority will takes care of all that, because regulatory authority will have some rules and regulations where people have to follow the same. Because whatever the business model an insurance organization has, and whatever the approach of the business they do, they can do it. But end of the day, there should not be any kind of information which may leads to misleading of information or something to the people. Usually that sort of thing won't be there, right? So there are some regulatory boards like regulatory authority, we call it as. These regulatory authorities will provide some guidelines for an insurance organizations, how they have to do their business and what assurances to be given to the people and what not, right? So that difference and that distinction we have to see, because otherwise what happens, as it is a competitive world, there are possibilities that they might be giving a different promises to the people, whoever is getting insured under that category. Usually that sort of thing should not be there. So that's the reason there is a regulatory authority everywhere. In every country there is a regulatory board. So this regulatory board will be looking after all this. Either it's an insurance organizations, or at the same time even it will be for even for financial institutions also, in order to eradicate the financial crimes by financial crimes or whatever the things and all. So in order to eradicate that, even financial institutions also will have a regulatory board which looks after all that, right? So they will frame some rules and regulations. Even a financial institution is doing business with the people money, right? So they are not investing their money, right? So they are doing business with the people money, so they are collecting deposits. In terms of financial institution I'm talking about, so against to that they'll be providing some interest of money to them, so the same money will be rotated even to the loans, will be given loans to the other people. So providing loans, even they have some restrictions, right? So all these things they have to be taken care of. So this regulatory authorities and all everything will also comes under the government control. But when it comes to Medicaid, state government, the major difference what is that you see from the federal to state majorly falls under the decisions as well as the regulations, as well as uh, what is eligible and what is not. Usually state governments will have an authority under the Medicaid. So depends on the condition, geographical condition of the particular state. Whatever the decisions are they taking, whatever the changes and amendments they do, everything will be comes under that category, right? So this is what the major difference you see from Medicare to Medicaid, right? So this is one thing which you need to know. So now there were a couple of questions. Let me answer these questions, then I will go back. Okay, so this is what the whole introduction about Medicare, followed by Medicare. And the next, this question asked by Dilly, any payment before the insurance covered? Yes, yes, whatever, yes, right. So whenever there is a service which have started, yes, before that it will be, yes. Next, PA, this has been question, I think, Okay, I think it's not a question like Saurabh. Okay, fine. Yeah, it's been questioned by Pradeep Shrestha. Do both employees and employer has to contribute 1/2 of FICA? Yes, normally employees do their contribution, employer even contribute from their end as well. Both happens, right? So based on the conditions, what is that they made? Okay. Yes, when it comes to the Medicaid itself, usually it falls under the low income group people, so that state governments will look after all that. But there are some uh, conditions apply on that, right? So that is one thing. This is a question by Sita. Yeah, because this question asked by Dina, like, can we take any dual insurance at the same time? Yes, can be, because most of the people, because one insurance plan may not be sufficient for their family usually, because health expenses are increasing day by day. So there are possibilities that single insurance plan or single insurance policy may not be sufficient for the organizations to manage, right? So for the, sorry, for the individuals to manage. So there are possibilities that dual insurances will be taken. But when it comes to the claims, whenever we are claiming, which insurance will be taken and all everything will falls under the insurance based upon the services provided by that health insurance and all. This will get varied. So because they get more reimbursement, that's the reason why more no, not reimbursement, more coverage, because dual insurances will be taken by the individuals due to the coverage part. But whereas if you take a government, see, for example, an employee is working where he get insurances, he may not be getting a full coverage, right? So there, because as I told you, the plans, whatever they make, is are the customized plans. They make customized plans here. When they are creating a customized plan, obviously there is a possibility that there are some limitation in terms of the claims, all that. So that may not be sufficient to the whole family, which they believe. So obviously there are provisions and there are possibilities that people can opt for dual insurances. Even private insurances will also be taken by the people, right? So that's what, yes. So dual insurances can be taken, yes. Normally, Medicaid is also falls under that category because it is majorly focused for low income group people. So the next was, in case of dual insurance, one of them will be your primary. Yes, obviously, right? So if you have both the insurances and all, yes, one will be the primary one and second will be the secondary, obviously. So priority matters, right? So Medicaid is majorly for people who are fell under the poverty line. Yes. So EOB stands for Explanation of Benefits, Pratishta. Explanation of benefits means when an insurance company is insuring the people, or when insurance company is providing or insuring the people for that particular insurance, whatever the benefits comes under that insurance. At the same time, whatever the services they are providing while at the time of claim, right? So normal insurances will be taken and that will be used only at the time of claims. Otherwise, there will be of no use, right? Normally, we don't expect, but if any requirement, so that that medical expenses reimbursement will be done through claim processing. So those rules and regulations has to be explained by the insurance companies to all the people who is getting insured. That's what we call it as EOB, stands for Explanation of Benefits. So insurance companies should provide all the details in detail. So that's the reason why I have told you about the regulatory boards. Why these regulatory boards are because of that. Because regulatory boards will control the companies, organizations, in order to not to practice any kind of malpractices or something like, because no information, mislead of information or no false commitments or information should be provided. That's what generally the major thing which we focus more on the insurance sector. So these regulatory boards will make all the rules, right? So this is how you have to, this is the information you need to provide. All these things will be explained by the EOB, right? So explanation of benefits, something relating to that stuff. So when it comes to the geography play, when it comes to the geography here, uh, so contributions, it varies. If it's not 1.5, if a person has the ability to pay more than 1.5, yes, they have a provision, they can, because more contribution, they'll have more benefit. That is point number one. So geography means this is falls under the category of Medicaid, because state governments will have their own rule, right? So state government will have their own rules and regulations to be followed by the state, right? So head of the state, all that stuff. So the type of the kind of people who were locating there, so either economically, whatever it is, based on that, in order to provide welfare to the organization, welfare to the citizens and all, whatever the decisions taken by the respective state government, so that will be reflected. So that's the reason why I'm talking about geography here. Geography means that particular state, right? That particular state, whatever the services and all, everything. So that varies from state to state, right? So not every state will be the as same as this. That states will vary from one to another. So that geography, that is that itself is the difference. That is what we have to see. So whatever the decisions they have taken, whatever the rules and amendments they were making, in order to make it more convenient and more welfare friendly to the people. So that varying from state to state, that's what I'm saying. Basic standard structure of the insurances and all, everything remains constant, but it changes from time to time, right? So it depends on, but whereas Medicare and all, everything will be fixed by the federal government based on the conditions, based upon the rules and regulations, what is that they have framed. For example, in this budget, they are spending more for medical, right? So maybe for some other thing, right? So budget allocation, because it is impacting even on the budget allocation every year, what governments do, right? So whatever the budget they are allocating, for what, how much percentage of budget they are allocating. Based on that, there are possibilities that few more services will also be added into the existing ones. This COVID, all that things comes under that category, right? So because most of the countries, most of the countries have taken a quick decision on this, and they have included this treatment and all, everything in the insurance coverage itself. Otherwise, it will be a burden for people to pay huge amount of money in terms of the cash, so which will be a burden which most of the people may not be able in a position to pay due to their financial position. So that's why this is the best example, because government has taken very fast initiations and they have included it, so that it saves most of the people's financial this capacity, all that. So that is what the answer here is. I think there are a couple of questions today. A lot of questions are there. So Medicaid and Medicare difference is that just now I have told you. I think Vishnu, you can go through back. Medicare being taken care of by the federal government, Medicaid taken care of by the state government. That's the difference. As a BA, why do we explain this all to all of us? BA just to have a good knowledge on it. See, let's say how can I know, how come we know the person is coming from a healthcare background here, Isha? This is for a question of yours. Why am I explaining all these things? Because as in when we are learning healthcare domain today. So even a basic question about what is healthcare should explain to the BA people because we don't know which professional background people were coming from. You cannot say that everybody are coming from healthcare domain here, right? So persons may be having good knowledge on healthcare by few, but there are few people which doesn't have even a basic idea about the healthcare knowledge. So being a business analyst, and when you are working on an organization as a BA, when you are managing with the other people, when you are organizing other people, it is the basic fundamentals which you must be knowing, right? So for example, end of the day, let's say for example, you don't know the difference between Medicare and Medicaid, right? So when there is an interaction or when there are decision making which has to be taken by you as being a business analyst, don't you think that it reflects on your decisions if you don't know the basics, right? So the basics is required. So that's the reason why this explanation we are giving, right? So this is point number one. And second point to the question, as a BA, who do we explain this all to? Or just BA need to have a good knowledge on it? So the second question, answer is for the second question. Please close the camera. Please close the camera. Thank you. Right. So BA has to know that. Right? BA is not explaining this to anyone. Right. So my intention was not that. So being a business analyst, we must be knowing. So we need to have a knowledge. For that, we are discussing about all these points. Right. So I think the second question is the answer is there in the second question itself of yours, Isha. Okay. FICA, I'll be explaining it later, right? For contribution tax, all that stuff that I will be explaining later, Dina, right? So because I think today is the second session on medical. So from next week onwards, it will be. And it is the question from Sami, Medicare and medical insurance program for the people over 65 and younger. And then Medicaid is in a system. Okay, so okay, it's not a question. Okay, fine. Yeah, in case of dual insurances, how do we determine which one is the primary? That's what I'm saying. So this is an individual responsibility. If a person is having dual insurances and all, they have to make one as a primary and one as a secondary. So they have to make it. So the choice will be given to an individual, which one wants to make it primary and which one wants to make it secondary. So they have to take a call on it, right? So not by anyone else apart. So that's an answer for the question. Oh, there are a lot of questions. Is it possible a person contribute 50% of his income and got more tax benefit? Just for curious for this. And thank you for explaining. Okay, fine. Take the receipt of first insurance that's not covered and send it to the second. It's mainly okay. This is not a question. Okay, it's okay, Kavita. No problem. Right. Next. So once it is the question asked by Sheila relating to the medical expenses and all. Once the age, whatever the age are we talking about, 65 or more. So obviously that portion will be falls under this category, right? So government will takes care of all that, right? So all the expenses, yes, after 65, I'm talking about. Okay, fine. Right. So this is all about the questions which I have answered. Right. So any questions we'll see later. Right. So this is what generally the difference between the Medicare and Medicaid is what we have. Again, now when it comes to Medicare billing, usually this Medicare program will be divided into 4 different sections usually. Right. So because whenever the claim processing and all everything, right? So in reference to the billing part I'm talking about, when we talk about billing process and all everything in Medicare, I'm specifying about Medicare, not relating to Medicaid. Okay, please remember. So when we are processing the claims and all everything, usually of course claim duration will be, we say 30 days, but it may go up to 60 days even sometimes. That is one thing which I would like to clarify. And second point is that Medicare program will be divided basically into four different sections. So these sections are as follows. Part A is the first section. Part B is the second one. Part C is the third one. Part D is the fourth one. So Part A is a kind of plan which majorly confined mostly for inpatient services, especially. This is not something cover for outpatient, because there is a difference between inpatient and as well as outpatient. Outpatient services where a person has went to the doctor, met the doctor, and he has taken a treatment, medicines and all everything, right? So that is what it is. Inpatient services when people have joined in the hospital. So part A is the section which majorly confined majorly to the inpatient services like hospital insurance, I can say. It covers majorly of this night stays at the hospital, followed by the nursing facilities, right? Hospice care, all that. So all these things comes under the part A here. But there is a condition applies here in reference to the stay, right? Or in reference to the hospitalization I'm talking about. For example, an ex is a person who has diagnosed with something where he requires some medical attention, at least for a 2 days time or so, whereas he had joined for in a hospital for inpatient services. So when they have joined as into in inpatient services here, whenever they have joined into that, obviously there is a provision where they can reimburse the money what is that they have spent, right? So whatever the expenses and all everything will be covered by under the medical insurances, right? So whatever they have paid, it comes under that category. But majorly there are provisions sometimes with the same problem. If a person has rejoined within 30 days of time, with the same identical procedure I'm talking about, this insurance claim will not be applicable in that situation, right? So this is a limitation, I can say, right? So why I'm mentioning this as a limitation, because with the same problem within 30 days a person has joined, Medicare will not be providing for the second service, right? So for the first service they'll be providing, but whereas for the second services and all everything they won't be providing. So this is a limitation you can see under part A. This is the first one which is comes under Medicare. So part A majorly focuses on inpatient services. Again, I'm repeating. So inpatient services, nothing but whatever the hospitalization and individual uh, joined. At the same time, the nursing facilities, hospice care, everything will be covered under that. At the same time, limitations are this within the stipulated time. If it is not, so obviously that comes under the same category, right? So because it won't be applied for all the things, right? So it will not be applied for all the things. It is applying for everything. It is applied only for one time, not for all the time. So this is one thing which we have to see. So that is one thing which we have to observe here. Now, when it comes to part B, it's a kind of service which will be provided insurances for the procedures and as well as services which is not comes under part A usually, because part A majorly focuses on inpatient services as I mentioned you. But whereas when it comes to part B, what is that not covered under the part A will be covered under the part B here. where it focuses mainly on the outpatient care, right? So physician services like X-rays, some kind of nursing care, right? At the same time, durable medical equipments like canes, walkers, all the preventive services. All these things will be covered under the part B, right? So part A majorly focuses on inpatient. Part B majorly focuses on uh, the remaining outpatient care, all this stuff. So this is the second section, which is all about part B. Part C is a Medicare Advantage plan. This is also another name for Medicare. Part C is a Medicare Advantage plan. So this is the most common and as well as widely used Advantage plan, where this Medicare subscribers and all everything will have a coverage through a private organization, right? So private insurance organization, this coverage and all everything will be through a private organization. Normally, this is the plan which will be provided by the government to the private authorities here. So they'll be giving it to them. So in this Medicare Advantage, it is offered by the private HMOs and as well as PP organizations. But whatever the reimbursement uh, in reference to the expenses about the medical expenses and all everything, that will be reimbursed by the federal government in this case. So this is the difference you see when you are comparing with the earlier plans to Medicare, because Medicare Advantage plan majorly focuses on this, right? So it is majorly focuses on the private organizations, all these. And this Medicare Advantage majorly provided to the insurance or private insurance organizations, where they have to be taken care of their coverages and all everything falls under their category, but whatever the reimbursements and all everything will be provided by uh, the federal government and all everything here. This is all about part C. The next one we call it as part D. This part D is majorly provided for, this has been instituted majorly for prescription drugs improvements, all that, right? So it majorly provides the coverage of the prescription of drug cost, whatever the medicine cost I'm talking about, right? So whatever the medicine cost and all everything during the healthcare, especially. So that covers under this one, right? So part D majorly focuses on that part. So majorly covers all the medical drugs cost, everything will also be covered under the part D. So these are the four different services which will be comes under the Medicare part. So the first A1 part A majorly focuses, as I told you, focuses on inpatient services. Part B comes under outpatient services. Part C is a plan which will be provided and which will be collaborated with private organizations, where private organizations will takes care of all that, looks after all that. So part D majorly covers the drugs cost of the insurances, right? So these are the four different sections you see under Medicare, right? So when it comes to Medicaid, right? So when it comes to the Medicaid part, inpatient services, whatever I have explained you is about Medicare there, right? So here when it comes to Medicaid, Medicaid services are like inpatient and outpatient services will be covered under the Medicaid plan. At the same time, family planning care, pediatric services, followed by this prescription of drug cost, dental health, mental health, followed by physical therapy or speech therapy. All these things will be comes under the Medicaid plan. So that itself is the difference you see, where you will be having multiple plans under Medicare, but whereas in preference to the Medicaid and all, you don't have these options. We'll be having a standard ones available here. So this is the major services which you please mute yourself. So please mute yourself, right? So this is what the difference you see from Medicare to Medicaid, right? So this is all about the overall introduction about Medicare and Medicare. Now, what are the different procedure codes do we follow in reference to the diagnosis? It may be, or it may be for the procedures and how this claim cycle or claim processing works. What are the different stages of life cycle claim we have, and what are the different code numbers are we using for what reason, and about the HIPAA rules and regulations, all that stuff that I'm going to discuss in Monday session. Okay, so this is what is that we have covered is the basic explanation about the healthcare which I have explained you. At the same time, what are the authorities who looks after the services will be covered even. At the same time, Medicare and Medicaid is what I have explained on a basic note. So how about claims followed by the codes, procedure codes, all that. So because there are different procedure codes we use, like classification of ICD codes are there. At the same time, there are some procedure codes I'll be showing you. So yeah, so here, right? So 270, right? So we need to discuss about 271, 834. At the same time, 835, 837, 276, right? So these are the major codes, as I mentioned, right? 277. So these are the major codes which are we going to explain from next week onwards. Hopefully by next weekend it will be covered, right? So your course will be covered by the next weekend. It will be completed for you, right? So this is all about today. Next. Next question. Government takes care of the medical illness. Yeah. So this question was answered by to Sheila. Yes. And the next, in part A, does nursing facility includes both skilled and non-skilled facilities? Yeah, all the nursing facilities will be covered in it. Yes. Yeah, as I mentioned you, Sita, like we don't require to remember if that was the case. When we talk about the codes, there are a lot of codes are there. It may reaches even 100 number, even procedure codes, everything all put together. So all these things are not possible, and not required even. That's the reason why these I am saying you, right? So whatever the codes I may be explaining now, right? If you see here, there are some codes which I'm explaining, 837, right? So 835, at the same time 276. So these are the major codes which being a business analyst, you must remember. Remember means, of course, it's a continuous practice where, so 271, right? So 271 comes under what, right? So what kind of documents will be included in it? So if it is the 834, what are all the enrollments happens in 834? So these things you need to remember. So this is really important. So these are important things. So you don't remember required to remember all the codes, whatever are there in the healthcare. That is not required. Even because medical coding, people do the medical coding, even they also use the codes, right? So we are not doing the job, right? So being a BA, our responsibilities will be different. So we majorly focuses on the claim processing and adjudication. So which is something relevant to that. Those code numbers we have to know. We have to know and we have to remember. That is it. Okay, clear. Inpatient and outpatient is very different. It's very simple. Inpatient means people have joined in the hospital for the treatment. Outpatient means patient have visited the doctor, taken appointment, taken medical advice, came back. That's only the difference. Okay, clear. Yeah, 835, 834, 271, 276. These are the code numbers which you must be familiar with, right? So that process you need to know. because being a BA, this is where you need to know, but the basics is end of the day, it is required, of course, because we don't know, right? So we may come across, some people may ask, wherein you need to answer for that the same. Next, inpatient covers treatments that need to stay in hospital overnight. Outpatient covers for procedure treatments where you don't stay in. Okay, right. It's not the question. Yeah. So this is all for that. I think there are no questions. I think I have covered most of the questions whichever posted. So Monday onwards, we'll be discussing about the remaining things. Of course, not only code numbers, there are some procedure codes even. So we will be discussing about those points and all everything in the next session. I mean, Monday session again. Okay. Thank you. Have a great weekend.
Thank you.
Thank you. Bye.
Thank you, sir.
Thank you.